All right, so we are on part 3 for your chapter 1 in your Pharmacy Practice for Technicians book lecture video. So we left off, finish up slide 11. We're going to continue on with slide 12. So in the late 1800s, there was large-scale pharmaceutical manufacturing that began. So during this time, pharmacists began to mass manufactured products. So for example, aspirin. Yes, aspirin has been around for that long. Many of the pharmacies also began featuring the first soda fountains, which sold compounded tonics out of those. Both Coca-Cola and Pepsi were actually invented by or developed by pharmacists. So the 4 stages of the 20th century development and formalized practice and program. So the very beginning, you had traditional era of compounding pharmacist, which then transitioned to a scientific era of drug development. And then we phased into a clinical era of patient and technician education. So this is where a lot of the states started requiring certification. The ASHP started getting involved and accrediting pharmacy technician programs. And then currently where we stand is in a computerization and a pharmaceutical counseling era. So a lot of our tasks, a lot of our things have transitioned from paper to computers. A lot of our systems are automated, which is very helpful. It's actually an extra set of eyes and an extra set of checks and balances to make sure that we're ensuring patient safety. The counseling era. So in 1996, when 1990, when OBRA 90 was passed, which is a legislation through the federal government that required pharmacists to counsel. And part of that requirement is especially for anyone that is on any type of government insurance. So Medicare, Medicaid. In Arizona, we call Medicaid access, but it's the same thing. So any patients that are receiving their insurance benefits through either Medicare or Medicaid, it's a requirement that the pharmacists are counseling these patients, or at least offering the counseling. So the traditional era, so this was the first half of the 1900s. During this time, pharmacists still compounded about 80% or more of prescriptions. The pharmacist in training, known as the apprentices, were, at that time would have been considered today's pharmacy technicians. They studied from the pharmacist directly rather than going into any schooling or universities, even though that type of formal training did exist. The pharmacy assistants were also used received on-the-job training. In World War II, this increased the need for care for the wounded, increased overall the need for pharmacists and trained pharmacy assistants. The U.S. Department of Defense started formal training programs for medics and pharmacy technicians during this time. And this is when the American Society of Hospital Pharmacists, known as ASHP, was formed. The scientific era of drug development. So in the 1950s, the major pharmaceutical industry actually began to emerge. During this time, many new drugs and dosage forms were developed. Drugs were less expensive during this time, and they were more consistent quality that what the individual pharmacists were compounding, because they're done in a mass manufacturing environment. Pharmacists then transitioned from being, individual compounding pharmacists into merchants of factory-made products or, pre-manufactured drugs. Scientific advances during this time, the pharmacy schools added pharmacology and pharmaceutics to their curriculum. In the 1960s, pharmacy students could get a 5-year bachelor's degree. They practice on campus with simulated pharmacies. and they during that time worked in pharmacies as interns. That still happens today. If you go work in a hospital setting, and even in some of the retail settings, they have contracts with the U of A here in the pharmacy program, and those interns are working and they are still in pharmacy school. During this time, pharmacists were not fully utilized. Routine tasks, dispense medications was pretty much all that they were doing during this time. So it was actually until 1969, it was not considered ethical for a pharmacist to label medication vials or counsel patients. So up until that time, it just didn't occur. It didn't happen. In 1968, the ASHP developed the national guidelines for the training of pharmacy aides, which would be pharmacy technicians in hospitals. During that time, they began their first hospital training program. Trained technicians were generally employed in hospital pharmacies. So, up until probably the mid-90s in Arizona at least, there were very minimal pharmacy technician programs. And so a lot of the pharmacy technicians who have been in the pharmacy field in Arizona or Tucson specifically for any length of time probably did most of their on-the-job training within a hospital or a retail pharmacy and didn't necessarily go to school. The clinical era of patient and technician education. So in 1975, the Millis Commission report came out, and in that report it said the pharmacists are for the future, which defined pharmacy as a knowledge-based profession. So meaning that anyone that is in a pharmacy position should have an extensive knowledge, which is through education, to be able to be in the profession. This commission report also emphasized the clinical role of pharmacists. Because of that, it led to a new emphasis on clinical or patient-oriented pharmacy. So in that case, what that means is pharmacist is reviewing the patient's profiles. They're looking to make sure there's no drug-drug interactions. They're making sure that the medication that they are prescribed is correct for their treatment. And then counseling to the patients to make sure that the patients understand to become med compliant and overall is a better outcome for the patients. So in the new clinical role, the pharmacist advises patients and healthcare providers about the appropriateness and effects of specific drugs. The clinical era and patient and technician education continued on. So earliest implementers of pharmacists as clinical care providers were actually the HMOs, so the health maintenance organizations and teaching hospitals. So HMO pharmacists were encouraged to work in teams with physicians, and they would consult on drug therapies for chronic diseases, for pain relief for patients with chronic diseases, infections, working on with the physician on what antibiotics are appropriate for what type of infection certain patients have, to free up hospital pharmacists for clinical work. Formalized in-service training programs for pharmacy technicians developed. So during this time, this is where the technicians really began to get a very large chunk of roles and responsibilities and what we were supposed to be doing to kind of free up the pharmacists from doing the more hands-on tasks as far as preparing medications and all of that to to transition into a more clinical role. In the 1970s, new hospital training programs for technicians, and this is where technicians during that time actually learned how to prepare IV solutions and other tasks. Now, keep in mind, in the 1970s, the USP guidelines for sterile products and all of that are not the same as they are today. In fact, I worked with a pharmacist at the hospital when I worked in the hospital in Albuquerque. He'd been a pharmacist at that hospital for 36 years. He was a Vietnam vet. And he said that he remembered a time where he was able to go into the IV room in the IV hood while he was making an IV and smoke a cigarette. He had an ashtray right on the side of the hood while he was preparing IV medications for patients. So early on during that time. So imagine how far we've come from that. Community pharmacy technicians during this time, so retail technicians, formal training also began to start to develop for these. In 1979, the Massachusetts College of Pharmacy actually began the first pharmacy technician program. And in 1981, Michigan became the first state to actually use an exam to test the qualifications of pharmacy technicians. So Michigan was kind of the paving way for requiring pharmacy technicians to have education, to take an exam, to be able to work in that setting. The computer and pharmaceutical counseling era, so in 1999, the pharmaceutical counseling era actually began. So Dr. Charles Helpler and Linda Strand built upon and extended the Millis Commission recommendations. So this expanded the pharmacist role to also include ensuring the positive outcomes of drug therapy. So really getting in there and ensuring that they were reviewing all of the patient's profiles and that the medications were appropriate, that the right medications were recommended, that the patients understood what their course of therapy was, how long they needed to take the medication, what they needed to do to stay med compliant, which would ensure overall positive outcomes for our patients. This also, during this time, they developed the 6-year PharmD program, so they can get a doctor of pharmacy. This was in the 90s, so in 2010 it became a requirement. So after 2010 you could no longer graduate as a pharmacist with a bachelor's degree. It had to be a PharmD. So pharmacy schools at this time added pharmacokinetics, biochemistry, therapeutics, and pathophysiology to the curriculum. Computers began to replace typewriters, thank goodness, in the pharmacy practice. Pharmacy software began to be developed and implemented, and over the years has improved, which has not only increased productivity within the pharmacies, but has also increased patient safety. Drug insurance programs and generic medications expanded. So previously, most drugs were brand name, were paid for in cash. So there is actually, if once you get into a law section, and some of you have already had the law section, there's a specific act that was passed to encourage the continued development of generic drugs because they are significantly cheaper than the brand name. Because we started transitioning to so much of the computer-based tools and equipment, the need for computer education actually increased, and that's why in most pharmacy tech programs and even the pharmacist programs, there's sections of pharmacy software that you have to learn. New technician tasks included computerized entry of prescription orders and insurance billing information. So during this time, as we've transitioned, now pharmacy technicians are allowed to actually put the orders into the system. It's all checked and verified by a pharmacist, but prior to this, pharmacists were the only ones that did order entry. Now technicians are able to do order entry, and then we do insurance billing. In fact, we probably in a retail setting spend most of our time doing insurance billing. Pharmacy tech programs were developed in schools of pharmacy, also in community college and vocational schools. Vocational schools, actually what Pima Medical Institute is. More states require pharmacy technician exams. So as things have transitioned on, the roles and responsibilities of a pharmacy technician and how you can practice in a pharmacy as a pharmacy technician differ from all 50 states. There are some similarities, but there's not one uniform requirement across all 50 states. That's one thing that we as technicians are trying to change. But the requirements to work here in Arizona as a technician are completely different than California, New Mexico, Colorado, and so on all around us. Some are more strict. Some are much more lenient, so it just depends. If you plan on moving out of the state of Arizona, you need to contact their state board of pharmacy in whatever state you're going to find out what those requirements are. So, medication therapy management, known as MTM. So, this provided more complexity in drug treatments. When we started adding more drug therapies, we started adding new drugs to it. So, HIV medications, blood thinning medications. All of these things that started to come down the pipeline and are newer, it increased the need for medication therapy management because of the potential of harmful side effects from a lot of these drugs, and then the level of drug interactions actually increased. So the MTM recognizes pharmacists in the beginning only had partial information about patients' allergies, drugs they were taking, and supplements, so herbal or anything over the counter, and that more completed information or more complete information was needed. That's where the MTM comes into place. They're finding and gathering all of this information. In some of our hospitals here in the ER, they have MTM technicians in the ER to get all of this information from the patient while they're in the emergency room. In case they are going to be admitted, then the pharmacist has the full idea and full picture of what the patient is taking. Pharmacist identified as logical professional case manager and counselor for patient medications. That makes sense. The pharmacist are the specialist for the medication. The doctor is the specialist for the overall care, but there's not anyone out there that's going to know more about that medication than the pharmacist, and that's why they have taken on this role as an MTM. So patients also needed better and more information. So there was a lot of insufficient knowledge or lack of knowledge or lack of information that was given to patients when they were ready to take medications or when they left the pharmacy. And that became an issue, a safety issue. Obviously, it could also lead to a lot of waste. The pharmacy MTM tasks help patients choose, use, and monitor their drugs to achieve the best health outcomes. So what they're doing is they're helping to identify potential drug-drug interactions, adverse drug reactions. They're counseling the patients on the adherence of their therapy, meaning staying med compliant, taking their medication as they should be, and then identifying which drugs are covered by insurance. That's a big deal. If you have a patient that is prescribed something that their insurance doesn't cover, and there's an alternative out there that is covered by the insurance, why should we not be able to identify that to the patient? Because if it's not covered by insurance and it's extremely expensive, chances are the patient is going to walk away from it and not take it. MTM is now the core component training of pharmacists. Some insurance company will provide reimbursement to pharmacists for MTM services. The collaborative practice agreement is known as a CPA, is a legal agreement that outlines the pharmacist's role and what fee they can charge the insurance company in managing the drug treatment for their prescribers' patients. ASHP expanded its scope for reform and assessment into the Practice Advancement Initiative, known as the PHA. The Pharmacy Practice Model Initiative, as an overall goal, is to empower pharmacy teams with better tools to direct and monitor patient outcomes. So really what we're looking at going forward and what ASHP is looking for in pharmacy technician programs specifically is the level of education that you're getting to ensure not only patient safety, but quality of care, okay, improving their overall health care. And that starts with med compliance, making sure they have the right medications, making sure that pharmacy technicians are filling the correct prescriptions and not making any errors. So community pharmacies were also referred to as retail pharmacies. So you can have, if you look at slide 29, it breaks down institutional pharmacies and community pharmacies and which type of pharmacies fall under those two categories. So again, the community pharmacies are also called retail pharmacies, and they actually employ the majority of pharmacists and technicians. Probably about 44% Jobs in the community pharmacy involved more direct patient contact than any other pharmacy jobs in the field. So if you think about that, you have patients coming into Fry's or Walgreens or CVS. That's direct patient face-to-face contact. In a hospital setting, you aren't seeing those patients directly face-to-face. You are seeing the nurses and doctors and everyone else that is taking care of them. Community pharmacies continued, so independent pharmacies, a small group or one single pharmacist owns the pharmacy, which means all decisions will be made at the store level. Typically, there's more time and energy spent on customer service. In these type of settings, mostly compounding pharmacies is done in these settings. So there's a couple of compounding pharmacies here in town, and that's all they do is strictly compounding. The chain pharmacies are corporation owned, so we're looking at CVS, Walgreens, Targets, which is now CVS owned, I guess, Kroger, Safeway, all of those pharmacies, those chain pharmacies, which means decisions within these companies is going to be made at the corporate level. They dispense large volumes of prescriptions, and they really heavily use both pharmacy technicians and automation. In your institutional pharmacies, these are hospitals, institutional community pharmacies, excuse me, let's make this clear here. So in your hospitals, most hospitals, so TMC for sure, UMC for sure, they actually have a retail pharmacy inside the hospital pharmacy. So these service patients who are being discharged. So let's say they are brought in and then they're being discharged a couple days later. They can leave, and as they're leaving, they can visit the retail pharmacy that is within the hospital to have their prescription filled. Most employees of that institution, so TMC, get theirs filled there. Same thing with UMC or Banner. And a lot of, like specifically at Banner, they have a lot of doctors' offices within that facility too. So when a patient sees the doctor at the hospital, in the clinics, they can go to the retail pharmacy still on that same site and get their prescriptions filled. HMO pharmacies, let me see here. Oops. So HMO pharmacies have pharmacies within their clinics. So this would be like El Rio. Okay, there's no insurance paperwork. Prescribers, nurses, pharmacists all have access to the patient records. So even if one pharmacy and clinic is on one side of town and there's another one on another side of town, all of that's connected. Okay, so they can access patient records, patient information regardless of where they're at. Mail order pharmacies are a centralized operation. They do large volume of prescriptions and mail those out. There's actually one here in town. It's for the VA, so it services all of southern United States, the Southwest United States, for the veterans. So they can do anywhere between probably 60 to 100,000 prescriptions a day. It's all automated. They have a ton of technicians. It's in a big warehouse off of Ajo and Valencia. Palo Verde and Valencia. And you wouldn't know it's there. You wouldn't know it's a pharmacy. It just looks like a giant warehouse. But inside there, they work from morning through the night. They do have pretty much almost 24-hour shifts. And they're always looking for pharmacy technicians. It's it's not a federal position, but it is a contract staff position, but they pay really well. So that's another consideration if you're looking forward to that in the future, maybe working for one of those. We're going to go ahead and pause here and continue on reviewing the rest of the PowerPoint slides. Your assignment is going to continue reading and finish off the reading for chapter 1, so you could be prepared for your quiz coming up.